Welcome back, Dr. Sandhu from Bedford Chiropractic Clinic. So in that earlier video, I showed you sort of what an examination entails, and I explained a little bit about the importance of the feet and about the psoas, and sort of how we check sort of shoulder mobility and how we look for sort of weakness in the psoas. And by checking the psoas, we're also, of course, checking sort of the lumbar spine as well. And what I would also do with you, sort of in that initial examination, I would lie you down and I would also palpate and have a little feel sort of your spine as well. And I would also check sort of using sort of a process called activator protocol. Now, just to talk to you and explain about a little bit about the way I treat, I use a tool called an activator, and this is the activator here. This is the fifth one. This is the latest generation of activator, and it's a handheld device which is specifically made for chiropractors. Now, there's 55 years of research that have gone into making this. And this is the fifth generation, and what it basically does is it puts a very, very low amplitude, so quite a shallow thrust, but exceptionally fast. It's about 3 to 5 times faster than a human sort of reaction. So for example, let me just demonstrate with this. So if I do this, all I'm doing is hurting my knuckle. But if I actually sort of use this, and I've got this set sort of at sort of what would be the fourth setting, which would be used for the deep muscles and also, for example, the low back. Here, I'm going to just sort of set it here and watch what happens. Okay, it sort of basically puts a thrust right in there, and you can see how that sort of moves that ball quite easily without sort of me having to do too much to it, except just take a little bit of sort of pressure out of there. Now, this is exactly what is happening sort of in the body there, is that this little sort of pointer is putting a thrust through the body and relaxing sort of all the muscles leading into the joint. So let me demonstrate sort of what happens then. So if we just check sort of Richard's leg length, we can see straight away that his legs are short. Now that indicates from that protocol of 50 years of research that there is a shortening in the pelvis. So the leg isn't anatomically short, it's functionally short. And the reason for that is because there is some tension here in his lumbar spine, and that tension is making this leg appear shorter. So if Richard puts his left arm behind him, and we recheck that again, okay, you can see that something happens. His legs seem to level off. Now that tells me that there is definitely something happening in his L4, which is his fourth lumbar vertebra. A very, very important vertebra, because this is the one that takes the most amount of stress. Because of the anatomical shape of our human spine, the way that this curves in here, the way that curves in the opposite direction in our ribs, and the way that the lumbar spine curves, means that our L4 takes the most amount of stress just from gravity. And of course, when we sit, which unfortunately all of us do far too much these days, the pressure on that is phenomenal, and that's going to then create damage in that disc. And if you look at sort of most of the disc herniations that seem to occur in the general population, L4-5 is the disc that gets damaged. In men, it is also the nerve supply to the prostate. The nerve supply to the prostate. And unfortunately, prostate as a problem for men's health is increasing substantially. So I'll leave that with you to think about. So what we're going to do is we're going to adjust that L4, and we're going to see sort of if we can make a difference. So if I sort of go along here and I just have a palpate. Now, Richard, can you tell me what that feels like? Yeah. So it's unfortunately uncomfortable for him. So I'm just going to adjust that. So I'm going to set this to the right setting, and I'm just going to go along to the facet of the L4. So just to the side of the spine, and I'm just going to give a slight adjustment there. Now, it's very comfortable for Richard, but straight away we can see that his legs have leveled off. See that? So what that tells me is that we've had some relaxation sort of in his muscles there. And when Richard stands up, he'll find that there is a difference there. It feels much easier. So using this process, I can go and I can check the rest of his spine. So what I'm going to do is we also found that there was an issue in his neck. So I'm just going to go up and just have a quick look at his neck. So Richard, would you mind just looking up at the ceiling for me? So Richard's just moving his neck up, and straight away we can see there's a difference there. So that tells me that there is an issue with his neck, and it's here at C4-5. So I'm just going to go ahead and I'm just going to adjust his neck right here. Just in C4-5 there. And Richard, would you mind just looking up again? And that's fine. Now, just tuck your chin into your chest. That's great. And now look to the left for me. That's great. Now, if you wouldn't mind just pushing your forehead into the bench for me, because Richard is complaining of a little bit of sort of a feeling in his ear. So we're just going to check his occiput as well, and we can see that straight away there's a difference again sort of on that side, and it's actually his right ear that's being affected. So we're just going to have a look, and we're just going to see what's happening in here. And if I go along the sub-occiput, which is the base of the skull, and I feel in there, Richard, compare that one to that one. Yeah, and that's really quite tender. So we're going to go to one of the lowest settings on the activator here. And Richard, I just want you to tuck your chin in for me. And we're going to adjust there. And Richard, can you just look up for me? Look up all the way, and now look to the left. And we're just going to adjust there. And just push your head down again. And straight away, we can see that there's a difference there. So that's the activator. This is a system that we use for treatment. It's very gentle, it's very non-invasive, and it is absolutely effective. And I've been using this particular sort of method of treatment now for over 15 years and getting some amazing results with my patients, and I would love to be able to help you. So what I'd like you to do is call us today. If you have an issue, or if you know somebody that sort of needs our help, send this video to them. Get them to sort of have a look at it, and get them to call us today. Let's get that initial consultation sort of booked in. Let's find out what is causing your symptoms, and we'll take it from there. And I know that I'll be able to help you, and if I can, I will absolutely do my best for you. So to a healthy Bedfordshire community, I look forward to helping you all, and it's Dr. Sandhu. Look forward to seeing you soon. Take care. Hi there. Okay, so before you go, right, don't forget, over here is our details on how to call us. So our phone number is there, and absolutely subscribe to our channel and follow us on all the social media, Facebook, Twitter, Instagram, and I look forward to seeing you soon.